Hi, I'm Dr. Carol Brennan. I'm one of the pediatricians at Cook Children's City View on the southwest side of Fort Worth. One of the things that you will have to consider if you're having a son or a baby boy is going to be whether or not you want your son circumcised. Circumcision is a procedure that is usually done at the hospital after the first 24 hours of age, once the baby's been allowed to adjust to his new life. And it is a procedure in which the skin that covers the head of the penis is taken off or removed. And there are actually some medical benefits to being circumcised beyond the social and religious benefits. Those would be a reduced risk of urinary tract infection in the first year of life. Little boys that are circumcised are less likely to have a UTI compared to those that are uncircumcised. There's a reduced risk of penile cancer, which is not a very common cancer, but it does occur much less frequently in men that are circumcised. And there is a reduced risk for sexually transmitted diseases. The two procedures are done that can accomplish that for your son. One is a process where the skin is totally removed that covers the head of the penis at the time of the procedure. And the second one is more of a process where some of the skin is taken off initially, but then some is left behind and will gradually remove as the circumcision heals. In that method, a bell, a plastic ring, is put around the head of the penis to protect it during that healing process. Both processes take about 1 to 2 weeks to heal, and really after the procedure is done, it is like a simple abrasion, and your part in caring for it will involve just gently cleaning the area at times of diaper changes, and probably at least twice a day doing a nice cleaning with a good amount of warm water. It takes about 2 weeks to finish healing, so during that time frame you will be going to your pediatrician's office. So during that time your pediatrician will be able to guide you on how the healing process is going and if there is anything to be concerned about. The main things you're going to be watching for at home are going to be if the boy is not urinating adequately, say he goes more than 6 or 8 hours without urination, or if you see any unusual redness or swelling along the shaft of the penis. And one of the other aspects of newborn care is going to be caring for the umbilical stump. So once the baby's delivered, the cord's going to be clamped and cut, but there's going to be a segment that's left behind, and we call it the umbilical stump. And that is going to gradually fall off. So some parents really worry about it because it's something that's foreign, they're not used to dealing with. But rest assured, the biggest thing about the umbilical cord care is really not doing much. Because now we've discovered that it's totally okay to let the umbilical stump just dry out on its own. You don't have to clean it, you don't have to put alcohol on it, you don't have to put peroxide on it. You just let nature do its thing. So the biggest thing you all have to do is just keep the diaper off of it and just let it dry out, and it will come off usually 1 to 2 weeks of age. Feel free to give your baby a bath, but you have to sponge bath until that cord stump comes off. And if you have a little boy, until the ring comes off of his penis, if he was circumcised or his circumcision is healed. Once those two things have happened, then you can feel free to give a nice little soak in the tub bath. If your baby has a large bowel movement and gets poop everywhere, and that will happen, feel free to wash the umbilical area with nice warm water. But again, just leave the diaper off of it, turn it down, cut a wedge in it, and that way it'll dry out naturally on its own and usually be off by the baby's 2-week visit.